at the point of securing a loan to complete them. Your Excellency, you would remember that most of these 391 uncompleted projects across the country in the health sector are between 55 and 95% complete. It is our hope that by the end of the first term of the NDC government, we would have completed most of these projects and thus increase coverage and quality of health service to our people. Mr. Chairman, Your Excellency, ladies and gentlemen, this is our vision for the health sector within the medium term. We are committed to increasing the fiscal infrastructure of the health sector so that everybody who is sick will have access to quality health care. While we make efforts to increase the coverage of health services, we acknowledge the fact that the social conditions which foster and sustain diseases still persist. People's health depends on their access to education, safe water, nutrition, exercises, sanitation, safe housing, clean environment, and personal hygiene. We, on our part, are working with stakeholders to improve the health by focusing on these social determinants. We have to break the culture of treating people's illnesses and then send them back to live in the social conditions that create sickness in the first place. In this regard, we know that by people changing their lifestyles, they should be able to improve the health outcomes. Mr. Chairman, Your Excellency, ladies and gentlemen, whilst we provide medical services for the sick, we need to work hard to create the necessary conditions to make people healthy. It is only a healthy population that can create wealth for themselves and society at large. We have therefore initiated a program together with the Ministry of Local Government and Rural Development and Better Ghana Management Services to train over 200 health promotion assistants to support us to educate and create awareness on healthy lifestyles and healthy choices. The program will be launched in August 2010, after which selected unemployed environmental health graduates and in some cases SSS graduates will be trained to become health promotion assistants. These people will work with community structures to improve sanitation, personal hygiene and disease prevention in schools, marketplaces, workplaces, and the communities. It is expected that outcomes will improve as a result of the program, reduce the disease burden, and thus make the insurance scheme one that will be sustainable. Mr. Chairman, Your Excellency, I have heard of the concerns that have been raised in relation to the patient-to-doctor ratio and, for that matter, human resource ratio to the specialists. It is a matter that is being addressed, and I'll throw the challenge to all the stakeholders. But the bigger challenge has to be thrown to the Upper West communities themselves. The environment that will attract health personnel to agree to work in our environment is one that all stakeholders, rulers, will have to create. I have certainly heard in a subtle way the Regional Director of Health, who has assigned everybody a task except himself. I will assign him the task of ensuring that this project commences and is done in good time. Thank you very much, and may the good Lord bless you.
It is with a particular sense of pride that I address you today, and soon to cut the sword to officially commence work on the construction of 8 hospitals across the country, 2 regional hospitals and 6 district hospitals. This ceremony marks yet another milestone in government's commitment to improve the lives of our citizens wherever they may be. Just a couple of weeks ago, His Excellency the President, John Atta Mills, performed a similar sword-cutting ceremony to mark the commencement of work on the renovation of the Tamale Teaching Hospital. These developments are clearly important steps towards an effective overhaul of the healthcare delivery system in Ghana. A critical step towards effective healthcare delivery is to ensure access to quality health infrastructure and modern diagnostic equipment. This does not only ensure an improved working environment for the healthcare personnel, but also a conducive environment for care and treatment of patients. Several years ago, the policy for providing a first-class hospital in every region and district was put in place. Flowing from that policy, residents of Ho, Cape Coast, and Sunyani saw the construction of 3 new regional hospitals. Several districts also received new district hospitals. The people of the Upper West region must have been in despair as to when it will be their turn to enjoy the benefits of such improved healthcare infrastructure. Today, thanks be to God, we are here to bring that hope to realization. The accelerated growth of our airports have created increased pressure on existing social infrastructure, including healthcare facilities. The introduction of the National Health Insurance Scheme has also increased attendance at hospital facilities. It is necessary, therefore, to expand and modernize critical referral facilities such as the regional hospitals to enable healthcare professionals cope with the increased pressures. The projects whose sod we are cutting today were conceived to respond to the need for strengthening our health systems, capacity to manage and sustain high coverage of services, especially in deprived areas. The projects have also been carefully selected to respond to the current growing urbanization challenges with a view to decongesting and easing the pressure on teaching hospitals. They will, at the same time, address demands on the National Health Insurance Scheme and fill the critical service gaps, especially in the deprived areas. Based on this principle, we are today about to commence work on a 160-bed regional hospital here in Wa. Kumasi will receive a 250-bed regional hospital to ease the pressure on Okomfo-Anokye Teaching Hospital. 60-bed district hospitals will be built in each of the following district capitals: Tepa, Nsoko, Salaga, Trifopraso, Konongo, Dumasi, and a 100-bed hospital at Madina Adenta in Accra. Each of these projects will involve the construction of outpatients departments for all clinical disciplines, theaters, diagnostic services, accident and emergency units, inpatient services, etc. The project package also includes a complete installation of modern medical diagnostic equipment. Mr. Chairman, the facilities would also be provided with modern amenities such as central sterilization departments, laundries, maintenance and technical services, catering services, mortuary, and central stores. There will also be hostels provided for relatives to respond to our cultural need to be near our patients, medical and professional personnel, with a 3-year comprehensive maintenance program, including the provision of spare parts for preventive maintenance and Mr. Chairman, the civil works, mechanical and electrical works, and the supply and installation of medical equipment components will be completed within a 2-year time frame, while technical assistance for the support for the project will continue over a 3-year time frame. The total project cost for the 8 hospitals amounts to $339 million. Ladies and gentlemen, such is the nature of the project we are about to commission today. And I believe that with such a comprehensive approach, we can expect nothing but the highest quality for our people. I wish to announce also that plans are far advanced for the construction of another 5 polyclinics in various districts of the Upper West region. This is expected to bring healthcare closer to the doorsteps of our people. I'm doubly happy today because apart from the opportunity of cutting the sod for the commencement of work on the Wa Regional Hospital, I'm also happy to announce that the bill for setting up the Savannah Accelerated Development Authority was passed by Parliament yesterday. This indeed is happy news for those of us from the Savannah area of this country. SADA would be a developmental vehicle to drive the creation of a new growth pole in the northern part of our country in order to create economic opportunities for our youth and prevent them from drifting southwards in search of menial jobs. The President has promised to give his immediate assent to the bill in order that we can start the work of setting up the authority as quickly as possible. I would like to congratulate and thank all those who contributed in this effort to bring us to this stage. Dr. Sule Garba, Dr. Charles Jebuni, Minister Albert Azong, our MPs, traditional rulers, and the many others who helped my office to make this bill a reality. I say, Yebarka. Just yesterday, we were deliberating in Cabinet on the one-time premium payment for the National Health Insurance Scheme. This has presently been referred to a Cabinet subcommittee, and as soon as it is approved, it will be forwarded to Parliament for consideration. We hope to begin the implementation of this critical campaign promise sometime next year. I'm also happy to announce an important achievement in our health status. We are on track to eradicate guinea worm, hopefully by next year. From about 501 cases nationwide in 2008, we reduced the incidence of guinea worm in 2009 to 242 cases nationwide. Currently, for the first half of this year, as of July 31st, we have identified only 8 cases nationwide. I wish to commend Ghanaians and especially our staff and partners of the Ghana Guinea Worm Eradication Program for their good work, and I urge them to remain focused so that next year we can say farewell to this debilitating disease that has plagued us since the beginning of time. Let me take this opportunity to congratulate the few doctors, nurses, and other health personnel who, despite the challenges that they face working in a deprived region, have remained dedicated to their work and accepted posting to the Upper West region. On behalf of the President, the people of Ghana, and particularly the people of the Upper West region, I wish to extend our heartfelt thanks to you, and I wish to assure you that you will be richly rewarded not only in heaven but also here on earth. We pray for God's help and guidance for you, and may He keep you so that you can continue to render useful service to this region. Let me also thank Dr. Said and the team from Euroget for their patience and tolerance during the long, drawn-out process of negotiations for this project. Some other group would have given up and left. That they stayed and have seen this project to the end, such that today we are here cutting